If you want to connect with me or contact me, you can get me at stevemain.com. I'm here with Dr. Nario of Biointegrative Health Center. Biointegrative Health Center is in Reno, Nevada, and you can check them out online. If you guys have been watching the channel, you've seen many interviews with Dr. Nario on different supplements and vitamins and different IV treatments and diets and so on. So, welcome, Dr. Nario.
Hi, Steve. Thank you for having me back. Always a
So
pleasure.
let's continue our B vitamins. We talked about vitamin B 1 through 6 or 1 through, what is it? I think 1 through 6, right?
Yep, one B complex.
Last week. So let's talk about B12. Now, B12, we're kind of keep it in a category of its own. So, what is B12?
Well, Steve, B12 is actually a common supplement that we see on the shelves, even our own shelves. So it's either a single B12 or it's usually mixed in a B complex. And the local grocery store or health food store has this available for us. And again, in the medical field, B12 is always related to like red cells, nerve health, DNA formation, and it's always known as a water soluble vitamin and naturally found in animal-based food. And again, the mineral that it contains is called cobalt. That's why you would hear about cobalamins. And these are the more famous terms that these B12s are known for. And there are three active forms involved in the metabolism and usually found in injectable forms, but also in oral. But methylcobalamin is one, and it's usually used most of the time for neurological problems like numbness, tingling. Cyanocobalamin, always an injection, but if not given through injections, it's immediately lost through the kidneys. And it's always famous for that cyanide neurotoxicity. That's why cyanide, and which we avoid. And hydroxycobalamin, which is the last one, has high affinity to proteins, and that's why it's long acting. It's one of the longer acting forms of B12.
Okay, so what does vitamin B12? Kind of get into some detail on what does vitamin B12 do in the body?
Well, Steve, B12 always usually conjunction with folic acid. It does its magic that way in the body. And there's so many ways in how I can explain this. It helps with nerves, with DNA formation, and the most famous one for B12 really in folic acid is homocysteine. So homocysteine is just you have to think about it for the public. It's inflammation of your blood vessels when your B12 and folic acid are low, and this leads to heart attacks, strokes, and that's why vegans are not safe from cardiovascular diseases because they don't have that B12 when they don't take that animal meat in there. So that's why it promotes clotting, inflammation, and high levels of this usually are something that also now can be correlated to neurological problems like Alzheimer's, dementia, and even the sizes of our red cells to carry oxygen to the tissues are affected when your B12s are low.
Okay, so what are some of the signs, symptoms of a B12 deficiency?
Well, the thing there, Steve, is so many. It's so vague of a question, but the most common ones that we usually see would be like anemia, number one, and you would see the your red cells just getting bigger and larger, meaning the capacity of the red cells to carry oxygen is less, thus fatigue. And again, non-specific symptoms such as constipation, loss of appetite, weight loss, difficulty balancing, depression, confusion, dementia. So now we're going to the brain manifestation, even poor memory, even sore mouth or sores in the tongue, numbness and tingling of the hands, again, going back to the neurological deficits. And when you see neurological problems related to B12, this should be addressed immediately to avoid irreversible damage. You have to remember nerves are hard to repair. That's why ask your doctor not about B12 levels in your blood test, but it's called methyl malonic acid, which is a more accurate test. So always tell that to your doc if you have these symptoms that I just mentioned.
Okay, you guys, I want to rewind this and listen to that test again. That sounds important. So, um, some of the factors of what are some of the factors of not being able to absorb B12? Is that something that can happen? Maybe our body's not absorbing it. I know there's lots of different ways to take B12, but
Mhm.
how is it if I just take a capsule with B12 in it? I know there's always a lot in those capsules. Is that absorbable?
Well, Steve, when you talk about absorbability of B12, it's usually pertaining to the oral form of B12, which is the most common one out there. And the thing here is there's so many factors in how we absorb B12. One would be hydrochloric acid in our stomach. Another one is called intrinsic factor. Again, it's an enzyme related to the acidity of your stomach. So if you don't have these two, then it's hard to absorb B12. The thing here is both actually gets less and less being produced in our bodies when we age. So aging, as we know, is a big factor of how hard we can orally absorb B12. Another one would be the damaged gut. As I always say, that there are sponges there, or little finger-like projections that absorbs B12 or other nutrients as well. But as we of course we introduce bad food, for example, we get stress. Now we talk about if somebody has what we call like IBS, celiacs, Crohn's. All of these are indications that the damage in the gut, specifically in the small intestines, where these nutrients are absorbed, are getting less and less. And even, I guess I mentioned a while ago, sad news for the vegans and vegetarians who are more prone to actually produce B12 deficiency just because they're not eating animal meat. So there will be less risk for the lacto-ovo vegetarian. So bad news for me, I guess. So, but we'll make it up.
Okay, so I mean, obviously, you can absorb B12 through your food, um,
Yes.
and you can get it through supplements if everything's working right orally. Now, I
Hmm.
always do a vitamin bag. I do a vitamin bag a lot at the clinic, and
Right.
that has B12 in it, right?
Correct. Yeah. So that's why B12 is just given in so many different ways. But B12 supplementation is already out there. You would hear about fortification. That's why food that we buy in the stores like B12 fortified, meaning they added it already in there, thus showing everybody that there is a growing problem of B12 deficiency. And again, oral injectables, as you mentioned, through the IV, they're all available. But everybody needs to understand adults more than 50 years old or greater than 50 years old should be on supplementation. This is actually recommended by the Institute of Medicine. And as of course, these again, the factors I mentioned because of the acid that we produce, the intrinsic factor, that's why it's a must for them to have that. And the thing here is most common orally 500 micrograms that's available. And unfortunately, there's a small amount only that we can absorb through the gut. So that's why we go into injectables or IVs, especially when we have deficiencies. The orals cannot treat that fast, but the IVs can. And you would notice this usually with my patients that I give it to, like what we call the low B12ers, which are usually fatigued. When we give the injection, wow, they come alive because it's just a deficiency you treat immediately. And that's why bypassing that gut is the key when you want to give B12, either through injections, intramuscular, or IV. And again, even with B12 deficiency, as recommended by standards, it should be intravenous or intramuscular and not oral.
Yeah, that makes sense that if all of a sudden you get a vitamin B bag, which I know I've seen people in there just do a vitamin B bag where there's just the B vitamins in it, but there's
Uh-huh.
also vitamin B injections that can be mixed with other vitamins that I know you do at the clinic. So someone can
Mhm.
just come in and get their vitamin shot or their immune shot or whatever mixture is in that. that injection. I know that they can do that, but
Hmm.
it makes sense if somebody that will tell you right there that your B12 is low or it's not being absorbed. If you get a shot and boom, it wakes you up. That's an
Right.
indication that there's a problem. Um,
Yeah.
so if that happens, how often would someone need an injection that has the B12 in it or a vitamin bag? How often should they do that? Once a week? Or what would work to get their body back where it should be or to maintain where it should be?
Why? So that's a good question, Steve. The thing here is this: the standard dosing would be usually every week, or the standard regular, I guess, schedule. But you have to remember there are people who are really like down on the floor, down on the ground in terms of their levels. That's why we probably need to do more than that at the beginning. So this really now depends on the levels. Just because how I assess it, if a person gets an injection, they feel better. I'm just not going to give them injections over and over. I'm going to talk to my patient and say, hey, there's probably something going on. We need to get an objective reading on where our vitamin B12 is so we can actually get you into a protocol.
Right. No, that sounds great. You found out there's a problem, and that's a good way to find out if there's a problem. You wake up with a B12 shot. Okay, now let's look into this and come up with a protocol for you so that we can get your levels back up and get you feeling like a normal human being again.
Yeah, that's true.
Okay, well, that is B12. Multiple ways to do it, and they do that at Biointegrative Health Center in Reno, Nevada. I don't think you'll see a lot of the information on that online, but they do all kinds of vitamin B12 and all the other B treatments in a bag that goes right through. It's an IV, and also if you're pressed for time, you go in there and get a shot. If you're in the
Hmm.
Reno area, so that's Dr. Nario, Biointegrative Health Center in Reno, Nevada. Thanks for being with us, Doctor.
Well, thanks, Steve, for having me again. As we all know, knowledge is power. And thank you for letting me provide you with the edge in longevity and health maintenance, which I call the biological edge or the bio edge.